Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you, Rachel. Good morning, everybody. I hope you had a great weekend and a wonderful Easter. I'm going to dive right into our topic for today on the different phases of the Part D drug plans. Rachel, can you confirm you're seeing my screen?
I can see your screen.
All right, thank you. Okay, so first and foremost, I want to remind everybody that the Medicare Assistance Program at the Oklahoma Insurance Department is funded by several federal grants that help us to reach out to Medicare beneficiaries to provide them with education about their Medicare benefits and what their options are related to Medicare. Those grants are the SHIP, or the State Health Insurance Assistance Program grant, which helps us cover the basics of Medicare and the different options that are available to folks. And then the SMP grant, or the Senior Medicare Patrol Program, where we're trying to educate people on how they can protect themselves from becoming a victim of fraud, waste, and abuse in the Medicare system. And then our third grant is our MIPA grant, where we're trying to find those low-income seniors who need some assistance in paying for their prescription medications and getting them signed up on that program so they're not having to make a decision between food and prescriptions. So what we're going to talk about today specifically is the Part D coverage phases. This has been a part of a lot of the presentations that we've done over time, but we always have to go pretty quickly through it. And we don't get to delve into the specifics of each one of those phases. And so what comes of that is we have people that are coming to us with questions saying, but I thought that was covered by this, or this would apply to that. And it's been problematic. So I thought, well, let's just delve into it a little bit deeper and talk more about Part D specifically, because there are some very big changes that will be taking place, some this year, some next year, related to Part D. So the first thing that we need to look at is what exactly is paying for that particular prescription medication, because that can vary on a variety of basis. One, where you're receiving that medication. Let's say that you're in the hospital and they're giving you medication while you're in the hospital. Any of that medication, particularly that is specific to the condition that they're treating you for, is going to be covered by your Medicare Part A, the part of Medicare that covers inpatient care. Now, in some situations, they may have you taking what we refer to as your maintenance meds, the medication that you take on a daily basis, maybe for blood pressure or something like that. They may have you bring in your prescriptions from home and continue taking them on your, out of your prescription bottle. But anything that's related to your care while you're in the hospital will be paid for by Part A. Any medications that you receive in a doctor's office, such as maybe if you come in and you've got a bacterial infection and they give you an injection of an antibiotic or something like that, or several of the vaccinations such as the flu shot, the pneumonia shot, those are going to be covered by Part B, as in boy. So anything that's in a infusion treatment for like cancer, those kind of medications are going to be covered by Part B. Now, outpatient prescription medications are going to be covered by Part D, as in dog. That's going to be anything that your doctor writes you a prescription for, and you go to the pharmacy and the pharmacy fills it. Now, there are also some additional vaccines that are covered by Part D, things like the shingles vaccine, which used to be rather expensive for a lot of our seniors. Those are now covered at 100%. You don't have any out-of-pocket costs for those vaccinations. So it's important to find out, what's going to cover those vaccines, whether it's going to be by Part B, as in boy, or my Part D. Now, there are other sources that can pay for prescription medications. Some people have access to prescription benefits through veterans, others through TRICARE, others through Indian Health Services. So we have to coordinate those benefits and understand. So I've got drug coverage through VA. I also have drug coverage through a Part D drug plan, or maybe it's TRICARE and a Part D plan, or whatever the case may be. Which one of those is going to pay in which circumstance? With your VA coverage, you may be required to go to a VA pharmacy or to get it through mail order. With TRICARE, if you've got only TRICARE for your prescriptions, then TRICARE is going to pay for it. If not, if you've got a Part D prescription drug plan, then the Part D plan is primary and TRICARE is secondary. So you have to understand what's out there that's eligible to be covering your prescriptions so that that cost can be coordinated. Now, in Oklahoma this year, there's 20 to 22 plans that are available. The cheapest one this year is $6.30. The most expensive one is $102.50. And as we've said before, what makes the difference between those plans is the prescriptions they cover. So you want to make sure you're not just getting on a cheaper plan, rather than looking at, does this particular Part D plan cover my specific prescriptions? Because you would be losing all the savings that you're trying to achieve by getting in a cheap plan as opposed to a plan that's the cheapest plan for you that does cover all of your prescriptions. Now, the maximum deductible that's allowed this year is $545 per Part D drug plan. Now, some plans may have a lower deductible or no deductible at all, but the most it can be is $545. There's also a maximum out of pocket for 2024 of $8,000, and we're going to talk more about that on a later slide. So the first phase, the initial phase at the beginning of the year where everybody starts, is going to be called the deductible phase. This is the time period where you're trying to meet whatever the deductible is, which, as we said, this year is a max of $545. So you have to meet that deductible before your Part D plan kicks in. Now, a lot of the Part D plans that are available have special circumstances where certain drugs they may provide coverage and immediately. Those drugs don't apply to your deductible. And you see that information if you're looking, when you're comparing Part D drug plans, that information is actually available in the detailed information of the plan comparisons. So you've got to meet that $545 deductible before you get into the next phase, which is the coverage phase. There we go. Now, once you reach the coverage phase, once you've met your deductible, now your plan's going to kick in with all of your drugs. During the coverage phase, the plan, whatever your Part D drug plan, is going to be responsible for approximately 75% of the cost of your prescription drugs. Now, how much the plan pays depends on the tier level of those drugs. If you're taking all tier 1 drugs, your tier 1 copay may be $5 or 5% or something like that. It's pretty low. Typically, your tier 1 drugs are like preferred generics or generics, something like that. The way that the costs are structured on Part D drug plans, as far as what you're paying, is going to be a copay or a coinsurance. And the difference between these two has been confusing to some folks. A copay is going to be a set dollar amount. It's going to be $5, $10, $15, something like that. A coinsurance is a percentage. So for your tier 1 medications, you may pay 5%, 10%, 15% of the costs. One of the reasons why that was set up that way is over the course of the year, the cost of your medications could possibly change. The cost from the manufacturer of the medication may adjust. It could go up, etc. So one of the reasons why they established this method of that payment is because if the cost of the medication to the drug plan goes up, then so does your percent of what you're paying. So that's the reason why with most of the Part D plans, we actually see a coinsurance now versus the copay. Now, so you stay in the coverage phase until what you've paid and what your Part D drug plan has paid reaches $5,030. Once you get to that level, you go into what is called the coverage gap. Now, by the way, you do include, when you're talking about what gets you into the coverage gap, you also throw in there any amounts that you paid related to your deductible. So it's your deductible, the 25% you paid while you are in the coverage phase, and the 75% that's paid by the plan. That gets you to that $5,300. Now, in the coverage gap, you pay approximately 25%. We're not going to spend a lot of time talking about what the coverage gap is today because we've talked about it a lot over the years and it's going away, which is a really good thing. But I do want to talk about what it looks like this year for people so that they know what they're getting into for 2024. So again, in the coverage gap, you're going to pay approximately 25% of the cost for your brand name drugs. What you pay in the coverage gap counts toward your out-of-pocket costs. The reason why we're talking about out-of-pocket costs is because that determines when you get out of the coverage gap. Now, in the coverage gap, the manufacturer is going to pay approximately 70% of the cost for brand name drugs, and that amount will also count toward getting you out of the coverage gap. There's an additional 5% of the cost that's covered by the plan, the Part D plan that you're enrolled in, but that amount does not count towards your out-of-pocket costs. So you're going to have 25% that you pay and 70% from the manufacturer that applies toward getting you out of the coverage gap. For your generic drugs, there's also a dispensing fee, and this has come up on some conversations we've had with people because they were caught by surprise. Yes, pharmacies can charge a dispensing fee, and for that, the 25% that you pay does count toward getting you out of the coverage gap. The 75% that's covered by the plan does not. For generic drugs, Medicare is going to pay a 75% of the cost of those medications, but that doesn't count toward getting you out of the coverage gap. Only the 25% that you pay counts toward getting you out of the coverage gap for those generic drugs. So kind of summing up what we're talking about in the coverage gap, the things that are going to apply toward the total amount to get you out of the coverage gap. Your yearly deductible that you paid at the very beginning. Also, any coinsurance, co-payments, etc. that you paid while you're in the coverage gap. The discount that you received, that 70% on the brand name drugs in the coverage gap, as well as the 25% that you paid for your generic drugs. Specific things that are not going to count toward getting you out of the coverage gap is going to be the drug plan premium, the $6.30, $40, whatever the premium is you pay per month for your Part D plan. the pharmacy dispensing fee, the part that's paid by the plan, as well as some people might have some prescription medications that aren't covered by their Part D plan. Some medications are considered for cosmetic purposes or whatever the case may be. Those don't count as well. So then, once you have met that out-of-pocket max, the $8,000 for 2024, you do not pay anything more for the remainder of the year toward your prescription medications. So that's the combined amounts of what you've paid as well as what Medicare's paid, all those discounts. Once that reaches that $8,000, you don't pay anything else for 2024. Because beginning this year, last year in 2023 and prior to that time, when you reached the catastrophic phase, you were responsible for 5% of the costs of your prescription medications for the remainder of that year. Starting this year, you do not have to pay that 5%. You don't pay anything once you reach that catastrophic phase. So here's a graphic, and we've used this one before in previous presentations, but it's a really good one. Kaiser Family Foundation created it. It kind of shows you in a really good visual of what we're talking about here. So last year, it's color coded. The orange is the enrollee. The lighter blue is the Part D prescription drug plan. The green is the drug manufacturer, and the dark blue, almost black color is Medicare. So all of them that starts out 100% is the deductible. That's the beneficiary's responsibility. In the first 2 years there, 23 and 24, 75% is covered in the initial coverage phase by the Part D drug plan, and 25% is the beneficiary's responsibility. Then in the coverage gap, we see those numbers that we talked about in the previous slide, where 25% is the enrollee, 70% is the manufacturer, and 5% is the Part D prescription drug plan. And then boom, you hit that catastrophic phase. And last year, in the catastrophic phase, beneficiaries paid that 5%. In 2024, however, that is not the case. Now, beneficiaries are going to pay zero. Now, what is going to fluctuate in 2023, the out-of-pocket spending threshold, the amount that actually came out of the beneficiary's pocket for 2023 was $3,100. For 2024, that is going to bounce up $150 to $3,250. So there is a little jump there. But once that is reached, once the out-of-pocket cost for the beneficiary reaches that number, then you reach the catastrophic phase and you pay zero. Now, as you can see from looking at this, there is a differentiation between the $8,000 total of what's spent on your medications versus the $3,250. So there's the out-of-pocket max for the beneficiary versus the total cost of your medications, which is the $8,000. The number that you want to be looking at is that $3,250. Well, where can I track this? That information is available on your monthly benefit summary, that notice that you get from your Part D drug plan that tells you here's what we've covered for this month, and here's your totals for the year. So you can keep track of that. You can also see this information if you have a Medicare.gov account. You can go in there and you can see what's been spent on your prescription medications and where you are in terms of reaching these different thresholds. Now, here's the really good news. Beginning in 2025, the donut hole, the coverage gap goes away. What we're going to be seeing next year looks a little bit different. You're still going to have your deductible phase, as you see in the last column on our slide here. But when you get into the initial coverage phase, you're still responsible for about 25% of your costs. 10% of that cost is going to be the drug manufacturer, and 65% is going to be the Part D drug plan. Once the out-of-pocket costs for the beneficiary, that's you, reaches $2,000, you're done for the year. You don't have to pay anything else. There is no coverage gap. There's no costs in the catastrophic phase. That's it. And for those of you who are on some pretty expensive medications, you see how much this is going to help. We have a lot of seniors that, God help them, they reach those amounts quite quickly, some of them in the very first month. So we're hoping that this is really going to be a huge, huge help for Medicare beneficiaries in terms of being able to stay on their prescriptions and stay healthy. Now, we don't want to get away without talking about extra help, because this is another very important program. Yes, we talk about it a lot, and we're going to continue talking about it a lot. This is a program that helps people pay their prescription drug costs. A lot of our seniors and other people who are on Medicare, income is a big issue for them. And so if you meet the income and asset limits for this program, it can pay your monthly premium for your Part D drug plan, and it dramatically lowers your copays for your prescriptions. So here on this page, you see what those income and resource limits look like. You see what what those can cost. Now, one thing that I do want to point out to you, the plans that are available to an individual, there are 3 different Part D drug plans for which a person who is on extra help would have a 0 monthly copay. Does that mean that's the only plans they can choose? No. If you're one of those people that actually has some prescription medications that you take that aren't on one of those 3, what we call benchmark plans, you can enroll in a different Part D drug plan, and it will reduce the monthly premium that you pay for that plan, because we want to make sure that you're on a plan that's going to cover your drugs, and it will still reduce what you pay in terms of copays for those medications. So it's still of great value to get enrolled in that Part D drug plan. The other thing that's nice about it, if you've put off getting enrolled in a Part D plan, but you do qualify for extra help, you're not going to have a late enrollment penalty. You're also going to have additional opportunities throughout the year to get enrolled in a Part D drug plan. Different ways you can apply for extra help. You can go to the Social Security website and apply there if you'd like to. You can contact our office, and there's our phone number and our website that we'd be happy to assist you with that process. Also, our partner agency over at Oklahoma Human Services, they also help with doing the same stuff with MIPA that we do, as well as they're very knowledgeable about a lot of other opportunities for assistance here in the state of Oklahoma. So there's some publications as well. You see one there that Social Security offers that you can reach out to. It's available on the website. You don't even have to print it out. You can read it right there. Wanted to share with you, this is the map of the coverage for our partner agency, the Oklahoma Human Services, regarding MIPA and where they cover. You see there, that's their phone numbers for those individuals that cover those parts of the state. So there's no reason whatsoever you can't apply for extra help. Also, if you've applied in the past and you were turned down, if anything's changed about your circumstances, or if you want to see if maybe you meet the thresholds now, apply again. There's no cost associated with doing that application. Our partner agencies that we work with around the state, these are the different agencies that you can contact, and you see the counties that they work with. These people have counselors that we have trained that you can contact, talk to, ask their questions. If they don't know the answer to a question, they know they can reach out to us, and we'll work with them to get you the information that you need. So now we're going to talk about questions. Rachel, do we have anything that we need to touch base on?
Yeah, so Ray, it doesn't look like we have any questions in the chat. So if anybody's got, I see somebody has raised their hand. If you want to type your questions in that chat box down at the bottom right-hand corner of your screen, we would be happy to answer that question. So we'll give everybody a quick moment to type that question. See if we've got anybody.
And while you're doing that, I'm going to go ahead and pop up here on the screen. Our next Medicare Monday topic is going to be Medicare coverage for mental health and addiction treatment. There's been some great improvements there that I'm excited to talk about. June is Fraud Prevention Month. We'll be talking about Medicare fraud. July, Medicare appeals. August, we're going to be getting ready for open enrollment. So we'll be talking about the Medicare marketing guidelines and any updates that are going on there. And then, et cetera, et cetera. Was Romelia able to type in her question?
I did not see it come through, but Ray, we can always have them email us if they have additional questions. If you want to share that email address to everybody.
Yes, it is. Let me see if I can get it. There we go. map.oid.ok.gov. As always, if you've got any questions whatsoever, you can reach out to us at that website, or excuse me, at that email address, or at our website even, and also calling us 1-800-763-2828. We are happy to help you with any of those questions or to try to point you in the right direction if it's something that perhaps doesn't fall under OID. You know, we want to make sure that everybody's getting the information that they need. I'm sorry you couldn't get your question in, Romelia.
I was going to say, you can always go back and rewatch our Medicare Monday webinars. They're all available on demand at our website as well under that educational videos tab.
All right. Well, if we don't have any other questions.
I see one more. I see another raised hand. Anita, if you guys can type your questions in that chat feature. So if you're looking at your screen, there should be an icon that says chat with a little bubble above it. If you click on that, you should be able to type your message, and then there's a little paper airplane icon in the bottom of that chat box. If you click on that and hit send, that will allow us to see your questions. Give one more minute here to see if we've got anybody coming through. And Ray, I think what we have listed on the screen here is the website address. I believe the email address is is slightly different than that. Is that correct? I believe it's
that is correct.
Okay.
Do you think do you think they're having problems?
It's very possible, guys. I'm so sorry if we're having a technical difficulty and you're unable to chat. Let me see if I can chat and prompt everyone. Okay.
Because I know that both
all right,
Teresa
guys,
and Marilyn,
I just sent a little chat, and hopefully you guys can respond to that. Ray, did you see that chat pop up on your screen by chance?
Yes.
Okay, great. Perfect. Got it. All right. Thank you for that confirmation. So it does look like people are able to chat. Got the chat. Thank you, Mary Ann. Wonderful. All right. So I'm going to give everybody another minute. Those two people who had their hands raised, if you see where those chats are popping up right now from the webinar, you should be able to hit reply on that and get your questions in. Ray, did you want to mention anything about our next in-person learning event while we're waiting for those questions?
Thank you for bringing that up.
Absolutely.
There is this month in
April 15th.
On April 15th, we'll have our next Medicare Monday.
Medicare 101.
Medicare 101. Thank you. We have a lot of Medicare. Medicare 101, which is the in-office, face-to-face training that we do. It's just an education opportunity. We do a presentation, but really what we're really there for is to answer your questions. It will be from 2 to 3 at our office at 400 Northeast 50th Street here in Oklahoma City. I want to make everyone aware so that we can start getting the word around. Our building is about to be going through some repairs, and we're not going to be able to use that location. So we are currently looking for an alternate space that we're going to be able to hold the Medicare 101 events, and we will get that information out to you as quickly as we can find some. We're looking at some other government, other state offices that have got some space that we're hoping to be able to use.
Perfect. Well, Ray, I haven't seen any chats pop in. I think that maybe we answered the questions, or maybe we didn't actually have any. But again, reach out to us either via email or by phone. And if we didn't get to you today, we'll be happy to help you there.
All right.
All right.
Well,
Thank you
thank you,
guys so
everybody. I
much.
appreciate y'all being here so much and look forward to seeing you next month.